Edutainment Studios welcomes you to Autism Spectrum Disorder, Beginning to Understand. This module is part 3 of a 9-part series. Autism is not just a single disorder, but is actually a spectrum of closely related disorders that have a shared core of symptoms. Every individual on the autism spectrum has some degree of difficulty with social interaction, empathy, communication, and flexible behavior. However, the level of disability and the combination of symptoms varies tremendously from person to person. In this course, the objective is to help you understand some of the causes of ASD. Autism spectrum disorder has no single known cause. Given the complexity of this disorder and the fact that symptoms and severity of each case can vary from person to person, there are most likely many different causes. It is believed that both genetics and environment play a role in causing ASD. Several different genes appear to be associated with ASD. Genetic disorders, changes, and mutations can greatly increase the risk of having some form of autism. Genes can affect brain development and the way that brain cells communicate to the rest of the body. They may also determine the severity of symptoms. Some genetic mutations seem to be inherited, while others occur spontaneously. Researchers are currently exploring whether environmental factors such as viral infections, medications, complications during pregnancy, or air pollutants play a role in triggering ASD. One of the greatest controversies with ASD centers around whether or not there is a link between this disorder and childhood vaccines. Despite extensive research, no reliable study has shown such a link. In fact, the original study that ignited the debate years ago has been retracted due to poor design and questionable research methods. Avoiding childhood vaccinations can place your child and others in danger of catching and spreading serious diseases, including whooping cough and pertussis, measles, and mumps. Researchers are also investigating other biological factors that might be a cause of ASD. Some of these include problems with brain connections, problems with growth or overgrowth in certain areas of the brain, problems with metabolism, which is the body's energy production system, and problems in the body's immune system, which protects against infections. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 3 of 9 on Autism Spectrum Disorder, and please join us for Part 4.